Muy buenos días a todas y todos que nos
Good morning,
acompañan a través de
everyone
las
who
redes
are
sociales y
here
también
with
por
us
internet en este momento de
face to
transmisión en
face and
vivo
online to
a través de
the
nuestra
launch of the
plataforma
special report
Internacional
on
Internacional,
health by ECLAC
dedicado
and
a la
PAHO.
tendencia de invertir en el sistema de salud
The
nacional de
urgency of
América
investing
Latina
in
y
health
Centroamérica
systems in
para
Latin America and the
fortalecer la
Caribbean to
diversidad
reduce
territorial.
inequality and achieve
Esto comenzará con
sustainable
saludos
development
iniciales del
goals.
primer jefe
This will
gubernamental,
begin
José
with
Manuel
the
Salazar Cirinás.
welcome
Nos
of
acompañan
the
además el
Executive
director de la
Secretary of
OMS, el
ECLAC,
señor Jarbas Barbosa,
José Manuel
y
Salazar
que nos acompaña
Sirinax,
desde
and Mr.
Washington, D.C., su
Jarbos
misión principal,
Barbosa,
quien nos
who is
presentará
with
la
us from
presentación del
Washington
documento que hoy
and will
será comentado
present
por
the
la ministra de
document that
Salud
will
de
be
Chile, la señora
discussed
Jimena Aguilera.
and commented by the
Desarrollará
Health
herramientas de
Minister
mejora de
of
política de
Chile,
planificación y evaluación del
Jimena
Sistema de Salud
Aguilera.
Social de Guatemala, la señora
Unfortunately,
María
the
Angélica
minister
Melgarejo,
from
quien nos va a acompañar en esta
Guatemala
ocasión, como estaba contemplado, por
will not
motivos de salud.
be with us on this
Esta es la
occasion
actividad estará a cargo del
because
director de
of
la División
reasons
de
of
Desarrollo
health.
Social de la CEPAL, el señor
This will
Alberto
be
Arenas de Mesa,
chaired by
el director
Alberto
ejecutivo de
Arenas of
Salud y
Social
Servicios,
Development of
director
ECLAC
de
and
Sistemas y
the
Servicios
Director
de
of
Salud de
Systems
PDVSA,
and
el señor
Health
James Fitzgerald, quien también
Systems
nos
of
acompaña
PAHO,
virtualmente.
Mr. James
Antes de
Fitzgerald,
comenzar
who
la
will be
actividad, les comento a
with
nuestra
us
audiencia que este
online.
evento cuenta con
This event
interpretación en
has
inglés, español
simultaneous
y pueden
interpretation,
pueden activar
English,
sus pantallas de Zoom.
Spanish, and
Para
sign
quienes no están en
language.
sala, hay
And
audífonos para la interpretación de
you
español-inglés.
can have
En este momento
headsets
tengo
in
el
the
gusto
back
de
of
darle
the
la
room.
palabra al
So
secretario
now
ejecutivo
I
de la
give the
CEPAL,
floor
el
to
señor
the
José Manuel
Executive
Salazar
Secretary of
Cirinás. Por
ECLAC,
favor,
Mr.
escuchamos.
José Manuel Salazar Sirinax. You're recognized. Good morning. Thank you, everyone. I cordially welcome you to the launch of this special report on health that the Economic Commission for Latin America and the Caribbean, ECLAC, has developed jointly with the Pan American Health Organization, PAHO. The document is entitled The Urgency of Investing in Health Systems in Latin America and the Caribbean to Reduce Inequality and Achieve Sustainable Development Goals. And the title suggests the importance of the subject. I would like to extend special greetings to the director of PAHO, Mr. Jarbas Barbosa da Silva, who is with us from Washington, D.C. I thank you this joint work that is within our framework of collaboration of both institutions. It's highly enriching for ECLAC to work jointly with your team of PAHO. Cordial greetings to the Minister of Health of Chile, Ms. Dr. Jimena Aguilera. It's Madam Minister. It is a special pleasure to have you here in ECLA. It will be an honor to have your comments to the document that will be launched today. And finally, I would like to thank the great work conducted by the team of ECLAC and that of PAHO. Thank you very much to the Director of the Social Development Division of ECLAC, Alberto Arenas de Mesa, and Director of Systems and Services of Health of PAHO, Mr. James Fitzgerald. This is the third special report of health that ECLAC and PAHO published jointly in the last 4 years. The first one of them, health and economy, a necessary convergence to face COVID-19 and resume the path towards sustainable development in Latin America and the Caribbean, was published in 2020 when some of the countries of the region were described as epicenters of the pandemic with very high world statistics of cases and deaths due to COVID-19. In that first joint report, we said that only economies of the region could be reactivated when the curve of contagion would be flattened out and the health crisis would be controlled. The report proposed an approach of 3 phases: adoption of health, economic, and social policies designed to control and mitigate the effects of the pandemic, and the reactivation with protection and reconstruction in an inclusive and sustainable manner. The second report, a special report on health published in 2021, the prolongation of the health crisis and the impact on health, economy, and social development. The moment when this was published was the second document was when we were coming out of the emergency, but still there was a social crisis and prolonged health crisis. In the document, it was pointed out that it was key to reach economic sustainable growth. Governments were urged to accelerate processes of vaccination, transforming social health systems in order to strengthen in public investment and consolidate welfare states, among other measures. This third report that we launched today and we present after the opening, jointly with PAHO, we emphasize health as a key essential element to reach a more productive, inclusive, and sustainable development, and also how development models generating inequalities are translated into a deterioration of health of the population. Health is a key element in the expansion of social protection systems in the region in order to overcome traps and gaps of development faced by Latin America and the Caribbean. Thank you very much, Executive Secretary. Now we invite Dr. Barbosa to hold the floor. Thank you. Good morning, everyone. Dear José Manuel Salazar Sirinax, Executive Secretary of ECLAC, it's a pleasure to share with you this activity. Dear Jimena Aguilera, Minister of Health of Chile, a friend of long time, and dear Abelardo Pinto, it's also a pleasure to have you and other authorities of health and development of Latin America and the Caribbean that are connected today. Firstly, I would like to thank and congratulate our colleagues from ECLAC and PAHO because of the work in this policy brief that we have entitled The Urgency of Investing in Health Systems in Latin America and the Caribbean to Reduce Inequality and Achieve the Sustainable Development Goals. No doubt, this work wouldn't have been possible without the synergy and collaboration that we have attained between the two organizations. This publication arrives in a determinant moment for our region. Only 6 years are to come in order to meet the 2030 agenda, and we face challenges that threaten to prevent the progress. The impact of COVID-19, jointly with other interrelated crises, has generated alarming backwardness in our region. I want in this presentation to bear in mind a fundamental data. The implementation of actions towards SDGs has gone back 32% in Latin America and the Caribbean. And this backwardness is especially concerning in the health indicators, as well as rise in maternal mortality, the reduction of immunization scope, and mental health.
From the perspective of the health and social development sector, on the actions that we believe are necessary to address the current context, reducing inequalities, and accelerating towards the achievement of SDGs. We are rebuilding on our previous work together with ECLAC on two very important policy briefs during the pandemic that highlighted the interrelationships between health and the economy in the context of a global public health emergency, and the need for the region to invest in greater resilience, including the production of vaccines and other health technologies. Let me thank again my good friend José Manuel Salazar for his collaboration in this new joint policy brief, and also to thank the Minister of Health of Chile, Jimena Aguilera, who will share with us her very important comments. Indeed, this is more than just a policy brief. It's a call to action. Together, we can move forward on the recommendations we have set out and ensure a fairer and healthier future for everyone in the region, with health systems that are more inclusive, resolutive, and resilient. Thank you.
Muchas gracias, doctor Barbosa, por sus palabras y saludos.
Thank you, Dr. Barbosa, for your initial comments and words. I will now move on to the special report, which is already available on the webpage of both institutions. Executive Secretary, you have the floor. Please let us present this presentation. Well, thank you. We will move on to present in a joint manner. I will present the first part, yes, and then the director of PAHO The first thing is to recall, and this is the key subject, that health is key for the strategies of social and inclusive development. We see a landscape of a region that is subsumed in three development traps. One of low capacity to grow, one of high inequality, low social mobility, and weak social cohesion, and one of low institutional and governance capacity and very ineffective. The problem is that health here is linked to the three traps. It is directly connected with productivity, directly connected with inequality, and with social cohesion. And these three connections are discussed in the document. So to overcome inequalities in health, it's not only an ethical imperative, but also it's something that contributes to face the development crisis and, of course, face these three traps and gaps. Also, health systems are characterized by important structural weaknesses. Focusing in the economy and health, there are problems of underfinancing and of very high out-of-pocket expenditure of individuals, of persons. And there is a public system and a private system, and we'll see details on it. There are high levels of fragmentation in the provision of services and segmentation of persons according to their payment capacity, another dimension of inequality. And there are weaknesses in the institutional capacities, governance and coordination related to problems of sufficiency, access, equity, and efficiency. All of this generates deep weaknesses and inequalities in access to health. During the pandemic, this situation translated into high levels of excess deaths. 27% of the world total deaths due to COVID-19 between 2020 and 2022 in a region where accounts for 8% of the world population. Also, we have the diagnosis that there are a series of indispensable transformations, as called in the last document for the session of 2 weeks back. One of them is the social protection. Of course, there, health is a key component, fundamental component. We already said that health is indispensable for sustainable development because it contributes to the dimension of social inclusion, productivity, and environmental sustainability. The pandemic evidenced the centrality of health for the economy. Fundamental is health for the economy. Without health, there is no economy. And we'll see the tremendous economic contraction generated by the pandemic shock. And so investment in health is key for sustainable development, economic development. And health should not be deferred in the public agenda. It should have a very high priority in development strategies because of the ethics, of the moral issues, and also the implications in other dimensions. Investing in health is investing in sustainable development. Here we see a graph that we have shown very frequently, but here we would like to focus and emphasize something else. The second lost decade, that is the issue from 2014 to 2023, the last one, there the average growth rate was only 0.9%, the lowest one in 7 decades. That is the trap of low capacity to grow. But that was linked to the fact that poverty stopped descending after a sustained descent or decline until 2014. And in 2020, extreme poverty increased in 1.9 percentage points, the highest level in 27 years. And the growth of employment was only 1.1%, the lowest one since the 50s. So you see low economic growth and low dynamism of the labor market. But directly related to the pandemic shock is to see the peaks there going down. And you can see, as compared to the shock and crisis of the debt crisis, beginning of the 80s, when contraction was 2%, and even the shock of the financial crisis of 2008 and 9, it was 3%. The pandemic shock produced a 6.9% contraction. That means that a crisis in health may have economic, social, impacts even greater ones than a financial crisis like that of 2008, 2009, when contraction was lower. And that makes it very evident and very clear what's the meaning of a pandemic, of a widespread health problem. The trap of low capacity to grow, to link it to that subject, places restrictions on the possibility of financial sustainability of health systems. Here we see a similar graph to the previous one. In 30 years and 15 years with those averages, and not to repeat what it's clear that we are in a low capacity for growth trap, but rather one of the consequences of being in that low growth trap, tax revenue is much lower, and therefore to cover a series of developments in health, education. It's difficult because the fiscal space is more limited. That is one of the reasons. There is another reason for limited fiscal space that is detailed in the document, and because of time, I won't go deep into that. Always financial sustainability. That is a major issue, major topic in the report. This is critical to maintain a health system that is well funded, financed. And the purpose is to consolidate the broad development. Objective is to consolidate systems, universal, integral, sustainable, and resilient health systems, and that requires investing public resources in a sustained manner in time, and therein is the issue. So the sustainability of health systems will depend on three elements: the subject of coverage. Of course, the more universal the health system or coverage is, it demands more resources. Sufficiency of benefits, how much can be invested per person, and financial sustainability in terms of financing source. If there is an imbalance among them, the sustainability of the health system will be jeopardized. A universal and sustainable health system reduces inequalities and guarantees access to health for present and future generations, regardless of the payment capacity.
So this is a very brief summary of these issues. Now we have this dimension in the sense that there is a combination between low public expenditure on health and high out-of-pocket expenditure that explains the financial lack of protection of households. In 2021, 28.2% of total expenditure on health was out-of-pocket expenditure. That is the average represented on the red line, and you can see countries that were below and others that were far higher. Out-of-pocket expenditure that was far higher.
A gastar más de su propia bolsa.
That means that people are forced to spend a lot more because there is no public protection system, and resources must come from somewhere. Over the past decades, public resources devoted to health have increased, and they have reached 4.5% of the GDP in 2021. That is a good trend. However, it is a figure that is below the 6% of the GDP that PAHO and the WHO have suggested as a goal. Only 7 countries achieved 6% of GDP in 2021, which is Cuba, and there you can see the data: Uruguay, Colombia, El Salvador, Nicaragua, Argentina, and Bolivia. And therefore, there is a major challenge in terms of financial sustainability, and there is a lack of financial protection, especially in countries that have a low percentage of public expenditure on health. A lot is mentioned, and this is a term of specialists. A lot is talked about the social determinants of health, that as a result of a WHO definition are the circumstances in which people are born, grow, work, live, and age. Basically, how Within the nodes of inequality, we position each person as from birth and throughout that person's life, and this conditions health inequalities. For example, you can see a graph there that has life expectancy upon birth on the x-axis, and the issue of labor informality in the y-axis, and there is a clear correlation. Life expectancy is lower in those countries that have a greater level of informality. The health of the population relies on strong social determinants, issues such as poverty, labor informality, educational level, and there are graphs in the report that evidence inequality and access to health in accordance with the positioning of each person around these categories, and that implies that this not only involves health policies, but also intersectorial policies that tackle these social determinants of health.
La idea que se refuerza aquí en
And the idea that is reinforced in this graph is that we require comprehensive policies, and thus there is a point there on the link between primary health care and social protection. This comprehensive and intersectorial approach which is recommended in the report, that health be coordinated with all the other components of social protection so that we can truly promote virtuous cycles in this issue. And this is especially important during periods of crisis, as became evident during the pandemic shock. And again, PAHO and WHO recommend a minimum of 30% of public expenditure on health and public expenditure for health, and therefore health is fundamental, as is clear to us all. It is a right, but it is also a requirement for the economy, to the extent that it is related with labor inclusion. It promotes productivity and is important for economic growth and in order to reduce inequalities. The idea that it is important to guarantee financial sustainability together with the efficiency in expenditure on health. Just as when we discuss education, we have to make an efficient use of resources. And in order to overcome the development traps, it is crucial to implement comprehensive health policies. And this not only to overcome these traps, but also to reduce the gaps that characterize countries in the region. That is the end of my part. Thank you, Executive Secretary, for your presentation. And now we offer the floor to Dr. Barbosa, who will share his screen via Zoom. And in the meantime, I thank the participation of more than 250 people that are connected online, and also the people that accompany us in this room. Dr. Barbosa, you have the floor.
Muchas gracias.
Thank you.
Muchas gracias.
Thank you very much. I believe that following that excellent presentation, I would like to share some ideas that are present in the report, and I invite you all to have a look at that. First of all, we call attention to the links between SDG 3 on health and well-being with the whole 2030 agenda. This independent relationship that health has, especially when it comes to access to clean water and sewage, poverty reduction, food security. In other words, all the links that characterizes that interdependence. We would also like to call attention to the double relationship that we have between poverty and health. We are aware that the poorest are the ones that become most sick because of different reasons, because of transmissible diseases, but also because of non-transmissible diseases. And therefore, it is the poorest population that evidence the greatest rates of growth and in terms of preventable deaths as a result of cardiovascular diseases. And therefore, we need to improve the quality of the health system, because that also implies a contribution, as from the health sector, to the reduction of poverty and to the promotion of a more sustainable development. And the third aspect that we would like to highlight is the need to always reflect the effects and the lessons of the pandemic.
Mais importante
I
emergência de
believe
saúde
that the most important public health emergency, which was the COVID-19 pandemic, has left us with important lessons that we need to highlight when we talk of a change and improvement of health systems so that they may become more resilient systems, more capable of providing the health care that populations require. This calls our attention to the fundamental need to strengthen this primary health care approach in order to guarantee universal health. The pandemic the pandemic and new access barriers to service. Latin America and the Caribbean is undergoing an accelerated demographic transition, an aging of the population. And at the same time, we can say that this population will become much more ill because of transmissible diseases, and that comes hand in hand with new technologies and new medicines that always poses an important challenge in order to increase to face up to the challenges of access to services. We have a certain stagnation in coverage, and we have fallen behind in terms of financial protection, and we must review the causes so that we are able to respond to that. We have also achieved progress in universal coverage associated to public expenditure on health, but also to a more efficient management and execution. In the past, and this is still ongoing, there is a debate about enlarging expenditure, because as has been highlighted by the Executive Secretary of ECLAC, in most countries of the region, the countries spend less than the 6% recommendation, but we must also find a more efficient management of the limited resources that we have available. And what we would also like to highlight is the need to maintain the policies to reduce out-of-pocket expenditure, which become an important barrier that impoverishes people and limits access to health, not only in terms of expenditure faced with catastrophic events, but also as a way to impoverish families. Here we have a graph that perhaps adequately summarizes something that we're aware of, but it's important to have the evidence at hand. When we look at the blue line, the government expenditure on health as a percentage of the GDP, and the red line, which is out-of-pocket expenditure, we see how in 2014 and 2015 this was important, and when we had greater investment on health, and how we have seen less out-of-pocket expenditure over the past 2 decades. And this responds to the strengthening of health systems and to the many changes introduced by countries in order to guarantee health as a right and to guarantee universal access, but also as the result of the strengthening and expansion of the coverage of health services. If in 2019 we saw an important increase in the blue line of public expenditure on health as a result of the pandemic, and the tremendous challenge that we face is to maintain financing at an adequate level, so that not only in order to respond to the pandemic, but also in order to improve the quality of healthcare and to improve coverage and access of people. For those objectives, it's important to maintain what we achieved during the pandemic. We also face some priority challenges inherited from the pandemic, and here we call your attention, first of all, to the issue of resilience. We know how this was critical, how it was critical during the pandemic to maintain health care to cater for some fundamental needs. When we look at the excessive mortality during the pandemic in countries where there are good quality information systems, we saw an increase in mortality as a result of all causes, not only the deaths directly associated to COVID-19, but more people died than what would have been expected as a result of cardiovascular diseases, cancer, and so on, because health systems were not resilient enough. They had to learn in practice how during the pandemic they could become more resilient in order to continue to provide care faced with these changes and to have the necessary flexibility that is required during this important crisis. Another important issue in the region, and that comes across in many countries, is the characteristic of the fragmentation of health systems and segmentations, inequalities, inefficiencies in promotion and prevention and in governance and leadership. And it's important to say that many countries in the region are undergoing transformation in the systems, and this is indeed one of the major challenges that we face. And what is also important is to acknowledge the more recent progress that has been achieved in Argentina, Chile, and Colombia, and others, for example. Also in Belize, that have reduced or eliminated out-of-pocket expenditure, have expanded coverage and access to primary health care, and other changes in order to reduce barriers and guarantee an effective access of people to health. Here we see how for some countries of the region, the main access barriers to health, and we can find, first of all, that the pandemic made access barriers much more acute. As expected, 88% of countries in the region reported some level of interruption of essential health services. These are surveys that we conducted during the whole pandemic. And therefore, there is a need to invest in health systems capable of greater resilience. And we find that in 8 countries of the region, we have healthcare needs that have not been met, or even greater after the pandemic, and that remain in place even if the pandemic has now ended for more than a year now, and we find that access barriers are not equally distributed within the region. We have groups that are much more vulnerable and that at a disproportionate level face greater barriers when it comes to gaining access to healthcare services, such as women, lower income groups in cities, and also the rural population, people with lower educational levels. The educational level is a proxy in terms of difficulties in terms of gaining access to all public services, and not only the inequalities that we have within countries, but also inequalities between countries.
Here, how do we see each one of the countries? It's quite striking that, for example, countries like Peru not only increased the difficulty of access to health, but also inequity itself. So it's important to check and review the data in each one of the countries in order to change that situation. I will now move on to English for the final part.
Then, and it's very important to highlight the key role of primary health care. The access barriers are not uniform between countries or within them. For this reason, the Pan American Health Organization is working with the ministries of health to identify the barriers and to adopt a specific strategy to overcome them. We call this comprehensive primary health care approach that is needed to be implemented nowadays, strengthen regulatory frameworks and governance, promoting interculturality, and improving the quality of care, and also to reduce and eliminate access barriers. This is essential if we really want to achieve universal health and to build more resilient health systems. Here we want to call the attention for the very important role of social participation. In many countries now, we have different alternatives of social participation in many countries, I think that more and more, and this is good for the region, that the national health systems are incorporating the perspective of the people that use the services. Since the identification of barriers, the identification of problems, but also calling them to be, I think that they are very important to have this very important role to monitor the quality, to monitor the barriers that we still have in many national health systems. Finally, I just want to share with you some recommendations, some thoughts that are in the report, that the accelerating recovery from the pandemic to achieve the 2030 SDG in a very complex geopolitical scenario is one of the very important challenges that we have nowadays. Now we have this not only in the region, but in the world, a very complex scenario that we need to deal with and to see how we can advance social protection, how we can advance the right to health in our region. Second, that Latin America and the Caribbean face the challenge of a structural transformation in development models to advance in the achievement of the highest attainable standard in health. Now, we are still in the process in many countries in Latin America and the Caribbean, to change not only the laws to guarantee the right to health, but also to review how we can change the national health system in order to respond to the fragmentation, to the lack of access in many areas of the countries to really achieve universal health. This idea, this concept that I think that guides us in our work in the region, that the health is a basic human right, that the health is fundamental to the comprehensive well-being of individuals and a prerequisite for achieving inclusive social development, economic development, and environmental sustainability. Investing in health is an investment in sustainable development. I think that the pandemic probably was this was one of the dramatic lessons that we learned, that without health, we cannot have economic and social development. So health needs to be at the center of the dialogue that we have in many countries about how to improve social and economic development in a more sustainable way. It is also important to call the attention that we need to target primary health care, this vision, this concept of a renewed and strengthened primary health care that should receive at least 30% of the global health, the global budget for health in each country, in order to have a primary health care that is connected, that it can offer telehealth, telemedicine, that have the healthcare workers trained and able to respond to the very complex epidemiological scenario that we have in our region. Also, to call the attention how important it is to address the social determinants in order to improve health. We still have many problems in our region. The access to water and sanitation is very limited in the huge slums that we have in the biggest cities, in rural areas, in many countries in Latin America and the Caribbean. Also, the very rapid urbanization that we experience in Latin America and the Caribbean, beauty cities that sometimes lack the minimal infrastructure. Of course, it's very important to explain the epidemics that we had last year and this year, for instance, of dengue fever and many other outcomes that are directly impacted by the social determinants. We are also working with the countries, and there was a resolution approved in our directing council a few weeks ago, that how important it is to strengthen the essential public health function and the public health approach in Latin America and the Caribbean, comprehensive and context-specific. So we need to identify for each country and each region what are the most important actions to be implemented. Also, that the transformations in our health systems require more public resources and increased efficiency. As I mentioned, I think that we need to overcome this false debate between more resources or more efficiency. We need both. And probably one very good example how we can increase the quality of the expenditure in health is exactly to strengthen primary health care. So we can provide care for the most prevalent problems that you have in the population, and at the same time, to organize better the access to secondary and tertiary level of the system. And finally, prioritizing the balance between universal population coverage, the sufficiency and quality of services, and the costs of financial sustainability of the health system. This is an increasing challenge that you have. It's very important to reinforce the dialogue between the finance, economic ministers, and the ministers of health in order to achieve this proper balance and to guarantee that the systems will receive the budget and the funds that they need. So that is some recommendations from this report that I also want to thank Clark for this very important partnership and to invite all of you to have access to read very careful this report. Thank you. Gracias.
Muchísimas gracias, doctor Barbosa, por
la presentación.
Thank you, Dr. Barbosa, for your presentation. Thank you, and Executive Secretary, for the excellent presentation of the report. Dr. Barbosa, as I was saying, this is already available on the website, so you're all invited to download and see in detail what was presented in this space. Now I have the honor of recognizing Minister of Health of Chile, Dr. Jimena Aguilera. Thank you very much for being with us here in ECLAC. Thank you, Maria Luisa, and greet all those here present in the room and virtually present. Thank you, Executive Secretary, for the invitation and comment this very important publication. And of course, congratulate the interventions of the director of the Pan American Health Organization, old friend, Jarbas Barbosa. The urgency of investing in health systems in Latin America and the Caribbean, it's a very timely document precisely because of the complex scenario that we systems of health represent after the pandemic. We share the idea that health is an essential component of development. Without health, there is no development, there is no well-being. If you analyze the main components in order to consider the well-being of the population, if there is no health, the others lose relevance completely. So we concur in the emphasis and the importance, critical importance of health for sustainable development in all of its dimensions, socio-economic and environmental. It's the schemes that you, Maria Luisa, I think you are the author, where you have the 3 dimensions. And without health, there's no sustainable development to be achieved. Certainly, when I mentioned the complex scenario of the pandemic, in fact, still we are not totally mindful of all the effects of the pandemic and continues to have for health systems. To implement recommendations, you need to consider that we have a scourge or a delay or lag of all the care appointments that were not achieved because of the pandemic priorities. We, government, believe in the right to health, in the social protection, and in greater interaction among social services and health services, as it is the idea trying to achieve in the different legislative agendas. And this same burden of undelivered care is added to other elements that make the population or make the scenario very complex. The aging of the population, as mentioned by Dr. Barbosa, we are a population that is aging very fast, and aging is associated to prevalence of chronic diseases, multi-morbidity. And after the pandemic also, we've seen that clinical conditions that are hospitalized are more complex. So to provide care for each patient involves a greater investment in technology, specialized human resources, because conditions are more complex. Another factor was mentioned, that is, when there are pandemics, technological revolutions also occur in the advance, in the progress of research sciences, and that involves new health technologies, new medications, new drugs. In parallel, we've seen in the 20th century how genomics have made progress, and today we have technologies, advanced genomics, but with a very high cost, over $1 million, and the availability of new therapies for pathologies that formerly had no treatment involves a new challenge for health systems. And jointly with the changes that have occurred in recent times, they come to determine another complexity or other complexities in order to account for these new needs. Technological progress, migration that occurred from cities to rural areas, that also changed the places where you had 1,000, 2,000 people living there, and all of a sudden they had population pressures, demographic pressures, and therefore we need to respond as to care and provide resources to sectors where population had gone down. And so, in fact, the pandemic, with all of its complexities and these added ones, make the overview and panorama very difficult for health system. As it was presented, Prabhu's showed structural expenditures, out-of-pocket spending is very high. This is characteristic in Chile, although it has gone down. And co-payment zero implemented in the government has helped to reduce the out-of-pocket expenditure. We still need a macro evaluation, but we have some estimates of how much this savings has been for families. Inequity in access and quality of care. So all of these issues, we make an urgent call so as to guarantee quality of care and primary health care as the main strategy. We said that universal primary health care is the heart of the transformation of the system that will not only guarantee access in all the places where people live, access to care that not only it's curative, it should be preventive. That's the main element we want to address in primary health care and emphasize, taking care of the population in order to achieve a healthier aging. Primary health care, when being universal and not discriminating, will help social cohesion, providing a concrete tool for the satisfaction and meeting of the right to health. And this primary health care has challenges. It needs to have greater resolution capacity precisely so as not to have these long waiting lists and people needing to resort to out-of-pocket spending so as to get greater specialty, which is not met in the primary health system.
Here is indeed the resilience capability that the system may have in during epidemics or emergencies. We have worked around that issue in primary care by being present in the territory with greater coverage, because that enables us to have a first ability to detect and respond to the various elements such as epidemics. They all begin as an outbreak. They all begin as a local outbreak, and therefore we need to, if we're able to detect and control it in a timely manner, we are able to control it and have a better response for the population, and also faced with disasters and emergencies. By having a primary care that is operating adequately, that implies gaining quick access to people, even in situations such as the ones that we have permanently experienced in our country: fires, earthquakes, floods every winter. And in those cases, the support of primary care is fundamental as a first link in the chain, and also in terms of mental health, and therefore the strengthening of primary care as a key strategy. Well, we fully coincide with that recommendation, and we have tried to established during this government, improving the coordination between health systems and social protection. Well, this year, as a year, we're commemorating 100 years of the existence of the Ministry of Health and 100 years of the Social Security Law. Together with the Ministry of Labor and the Ministry of Health. Indeed, when we face an aging population, what becomes most imperative is this cohesion between social and health services. And this coordination is indeed, for this coordination, the best health is primary health care. So therefore, at a municipal level, where we find primary care in our case, that is where intersectorial work comes to life. This does not involve a meeting of ministers or the drafting of documents or agreements, but at the end of the day, what this intersectorial work means is that if a person can gain access to social services in a territory, may receive those in a comprehensive manner, and we are trying to work on universal primary health care, integrating the information systems of the Ministry of Social Development with those of the Ministry of Health in order to encompass both needs and that at the same time people are cared for comprehensively and thus facilitating social and health care services. In the UK, for example, they have been working with this issue. We're also working on this aspect with the law on care. And why do we have a greater need with aging populations? Well, because there are a socio health interface that grows. In other words, pathologies that have both social and health requirements, such as dementia. We have longer life expectancy for people that did not survive in other times, but that have severe dependency, and therefore we needed to reach them in an effective, real, and coordinated fashion um, uh, without having redundant services from health and social services, and we need to increase health expenditure to 6 percentage points of the GDP, which is a key recommendation. We as a country have advanced in that direction. We still don't reach that level, and yet we have tried to also make progress and reduce out-of-pocket expenditure, which is still very important in Chile, and also making a more efficient use of resources. Alberto Arenas, who was present here and who was director of the budget for a long time, was also in charge of trying to introduce this system. Often for the ministers of the economy or ministers of finance, this is a great possibility of spending resources without really evidencing more efficient use. And therefore, I suggest that in future reports, we try to focus on how to improve the efficiency of expenditure on health. And after improving expenditure on health, well, where do we find the best examples to improve this expenditure for us? There is the coverage of vaccines and other elements that are cost effective, but in terms of the epidemiological profile that we face today with high complexity pathologies, we also need the public to be aware, and even that economic authorities be aware of the fact that there are alternative treatments that are cost effective, that may be costly, but that are effective and that can have results on the health conditions of the population and that aim towards greater well-being. And therefore, that is an issue that must continue to be present in the joint discussion within this interdisciplinary task of social services and health services. And social determinants of health in order to reduce inequalities is also important, and that forms part of the agenda of all health sectors ever since the Commission on Social Determinants of Health began to work, and even dating back to Salvador Allende's publication about the socio-medical reality of Chile that refers to the impact of the conditions in which we are born and how that has an impact on health. And yet, as ministries of health, we must respond to the social determinants that we have so that indeed countries and states can make progress towards in terms of reducing socioeconomic inequalities or in terms of reducing the issue of informal employment that are all elements that we must deal with. And how do we face up to them? Well, from the viewpoint of healthcare, well, trying to guarantee access via universal systems so that we don't find access barriers and neither for migrants or informal workers, and so that indeed, as mentioned initially when it comes to primary health, that we produce an effect of social cohesion via primary health care, which is a basic tool of the right to health that we can all resort to. And we can resort to that being rich, poor, living in good neighborhoods or more poor neighborhoods, but that be a universal factor, and so that we can add a first and as a stepping stone, so to speak, where we are all equal and exercise a right, so that we can jointly um, treat people with different social backgrounds, but faced with a health condition, they all enjoy the same right. Now, with regards to the improvement of health systems in order to respond to future crises, we also find that coordination between different sectors and the work at a territorial level in primary healthcare is for us extremely relevant, and also to guarantee financial sustainability of health systems is work that is ongoing. We feel that indeed the macroeconomic context that we have at present of low growth, high debt level, fiscal restrictions implies that decisions have to be made in terms of devoting policy so that we achieve greater growth, so that we can have more fiscal revenues and devote more resources to the health system. And we, at the same time, have to be responsible for using those resources efficiently. This report urgently calls upon countries to prioritize investment in health and to introduce reforms that create a resilient and comprehensive and universal system in order to reduce inequality and contribute to sustainable development in the region. And certainly we share that approach. The text does not dwell in depth or at length in private health, in the private health sector, which is a reality of our region. Certainly, this is an issue that I believe is also important and that should be highlighted in terms of how we can have a more positive relationship with the private sector. For us, the private sector implies, for example, whenever we talk about out-of-pocket expenditure, we are referring to that sector. People are resorting to the private sector and spending out of their pocket because we are unable to satisfy their demands via the public system, and in consequence, we have to work there so that we can have a relationship whereby we find a more virtuous relationship and a more efficient use of private resources. In this country, we have tried to work on that issue. For example, last year, or this year rather, in May of this year, on occasion of the law that we had to implement in order to account for the sentences of the Supreme Court on private health insurance companies, we approved the supplementary coverage formula for the public sector. And that is an innovation in the sense that public insurance in Chile that caters for 32% of the population, the possibility of bidding out supplementary private coverage to the public health insurances on a voluntary basis so that people could use free selection, which is a kind of very relevant out-of-pocket expenditure in the public insurance, but with greater financial protection, and indeed tries to point towards the existence of a private health provider so that we can meet the needs of the population that cannot only be met by the public sector, but with greater financial protection than what exists today. Likewise, we have other initiatives so that private expenditure by people can receive greater protection when it is aligned to health priorities, such as, for example, the pathologies that lead to greater waiting lists, which is a prioritized system that we are developing at present. And therefore, we are indeed trying to focus on this way of working in places where we find the biggest out-of-pocket expenditure, so that we can have a more a larger, a stronger health approach, and to try to reduce that with zero co-payment in the public sector, but also to exert influence on out-of-pocket expenditure in the private sector. Within out-of-pocket expenditure, what is a very relevant component is expenditure on medicines, which is an important issue and relevant when it comes, when we consider that there are new elements, new technologies that produce greater inflation in health expenditure, and therefore we need to regulate that adequately and guarantee access to drug therapies. Despite the fact that we invest significant resources on that, we still evidence that there is a strong consumption of medicines that are paid out of pocket, and therefore we need to make headway with all these elements that determine this out-of-pocket expenditure in our region. Another element that is also relevant and that sometimes leads people to leave the public system and focus on the private sector refers to expenditure that, in our viewpoint, are not the most efficient. And that has to do with patient satisfaction, which is also an element around which we need to continue to make progress in terms of having better quality of services with greater patient satisfaction, so that this may also contribute to a more adequate use of public systems and to make headway towards a universal coverage. Basically, and at the end of the day, I, as an authority reviewing this document, congratulate the timeliness of this document. I believe it's very relevant to highlight the urgency of investing in health systems. The pandemic processes tire people out, and in our sector, we have experienced an enormous health crisis, and often people feel that well, that is over, and that we don't want to have an additional health concern. But that is not what we see. We feel that health crises have become increasingly frequent, that the climate crisis that we're experiencing, which is the biggest determinant of health at a world level, implies that there is an increasing probability of having events that will have a health impact, and also epidemics that will impact us. The growth of dengue fever last year has shown how the mosquito is able to adapt both in Europe and in our region. In countries where we didn't have these mosquito outbreaks, such as Uruguay and even here in Chile, and that means that there is an expansion of this phenomena, and regrettably we cannot cast them aside, but rather continue to work on how to highlight the importance of health for development, and how important it is to continue to work around these issues, because it's essential for us to achieve sustainable development, especially in the region of Latin America and the Caribbean. Thank you very much. Thank you very much, Minister Aguilera, for your comments and for showing us the challenges, especially of Chile, of the issues that this publication refers to. Now we will close the launch of this special edition, and now I'd like to offer the floor to the Director of the Social Development Division of ECLAC, Mr. Alberto Arenas de Mesa. Thank you, and good afternoon, everyone. I thank you for accompanying us in the launching of this special report on health, the urgency of investing in health systems in Latin America and the Caribbean to reduce inequality and achieve sustainable development goals developed by ECLAC and PAHO.
I would like to begin this closing address thanking for this third joint report where we emphasize the importance of investing in health. I thank Dr. Jarbas Barbosa and Dr. James Fitzgerald for this new joint initiative. It will be a pleasure to continue working in future documents and projects. Cordial greetings to Minister of Health of Chile, Dr. Jimena Aguilera, with whom we have worked in primary health care initiatives and other aspects related to health reform. Thank you very much for your valuable comments and your face-to-face presence here in ECLAC. Also, thanks to the Executive Secretary of ECLAC, José Manuel Salazar Siriñac, for having promoted this special report and headed it with head of PAHO. Also, I would like to thank Maria Luisa Mariño, who has chaired the event and coordinated the work especially, and the team Consuelo Farias and Daniela Uneus. Thank you to the Office of the Executive Secretary, to the Public Information Unit, and the conference team for this support. In these closing remarks, three central ideas that I would like to highlight. First, underscore that health, as the executive secretary said, it's indispensable to advance towards inclusive social development. And it's fundamental to do this, or investing in health in a way with financial sustainability within that framework. As we said it in the special report of ECLAC and PAHO, the exercise or the implementation of the right to access not only helps in financing and reducing inequality and poverty, but also develop skills and increase of education, and that can translate into greater labor inclusion in different areas of society, and also potential increase of economic growth. That is why, in order to move towards inclusive social development, which is capital fundamental for development of countries. Number two, social protection and health is critical to overcome the crisis that we see in Latin America and the Caribbean. ECLAC has proposed 11 indispensable measures to face these challenges. One is the expansion of social protection and the welfare state. To move towards a universal, integral, sustainable, and resilient health systems is fundamental to expand social protection and a requirement to guarantee the right to health of persons. So investing in health systems helps implementing inclusive social development policies and thus reducing inequality, and thus setting the foundation for greater labor inclusion, greater productivity and growth. Number three, we know that inequality is a multidimensional phenomenon, therefore should be addressed with integral policies. This is also expressed in health insofar as access and results, and the structuring access of social inequality in the region based on the economic, social, and productive structure produce and reproduce inequality in the area of health, and health is a key element. Therefore, in this special report, we say that investment in health not only helps reducing inequalities in health, but in other areas. Thus, our call is to move towards integral and intersectoral health policies, including the other components of social protection to guarantee right and access to health, as well as to overcome the barrier of access and low social mobility in this continent. I invite you to read the special report, ECLAC PAHO, where we go deep in each and every one of the topics that we have addressed in this presentation. Thank you very much. Thank you, Director. And now we give the floor to the Director of Systems and Health of PAHO, Dr. Fitzgerald. You have the floor now.
Special note of thanks to all our colleagues at ECLAC, the Executive Secretary, Jose Manuel Salazar, of course, Alberto, and you, Maria Luisa, for your tremendous work in this report. It's really been a pleasure to work with you on the development of the analysis and also the recommendation emanating from it. A special note of thanks also to our director, Dr. Barbosa, for presenting the overarching analysis within the health sector and the recommendations moving forward, and to the team here within HSS under the leadership of Ernesto Bascalo. A special note of thanks also to Dr. Jerry Eikemans, the Director of Social Environmental Determinants for Health Equity, and her team for the joint analysis and recommendations associated with the linkages between social determinants, health, and health systems. One, I think, final comment, I think, really guides us moving forward. This really around the pressing need to strengthen health systems of the countries of the region with a specific focus on primary health care to address the post-pandemic setbacks and to really guide investments that will prioritize, as Minister Jimena from Chile noted, in terms of the comprehensiveness of sustainability and the resilience of our health systems to overcome, not just to improve health outcomes, but to really to overcome inequality and support the achievement of sustainable development. This really requires, as we heard from the Minister, leadership and political commitment in the approach, in the allocation of resources to the first level of care, in the organization of integrated networks, and really focusing on the differentiated needs of populations that are context specific, territorial specific, targeting those investments where they're needed, and thereafter linking, of course, and ensuring that there is the effective investments associated to address the social determinants in health, and in particular the needs in social care. I think Minister Jimena also noted some opportunities for the future, a greater analysis in the role and the relationships between public and private sector that are growing within the region, and to really examine in more detail the issues around the innovations that we've seen during the pandemic, not just technological innovations, but also in health workforce, and of course the rapid digital transformation that we're seeing throughout the region of the Americas. So from our perspective at PAHO, we really look forward to working with CEPAL potentially on the next policy brief, which I'm sure will explore many of these issues. Thank you very much.
Muchas gracias.
Thank you, Dr. Fitzgerald, for these closing remarks. And with this, we conclude the launch of the special policy brief of ECLAC and PAHO, entitled The Urgency of Investing in Health Systems in Latin America and the Caribbean to Reduce Inequality and Achieve Sustainable Development Goals. We invite you to download this, which is in the webpage. Thank you very much to all of you here present in the room, present virtually. Thank you very much.